My name is Tim Kim. I'm an anesthesiologist at Orthopedic Associates of Wisconsin. I chose anesthesiology primarily because I was actually a physiology major. So I think that's one of the things that really drew me into anesthesia is the aspect of the physiology as well as the pharmacology, which I found very interesting as well through my training. Anesthesia is the science of providing pain relief. So the number one thing that patients need to understand is anesthesiology, anesthesia these days is incredibly safe. The efforts of the American Society of Anesthesiologists have gone about providing an anesthetic regimen that is very, very safe, both in the monitors and in the medications that we use. Patient preference is very important. So we listen to the patient and what their concerns are and how we can best address those concerns with the type of anesthetic that we might provide. Patients, I think, benefit from having an anesthesiologist here at OAW in that the quality of care that a physician anesthesiologist can provide a patient undergoing anesthetics I think is unparalleled. Having an anesthesiologist here on site provides the level of care that the surgeons expect and that the patients deserve. The facility here is stunning. I think it's a great place to come to have a surgery. The facility lends itself to making it a very nice, very smooth process from pre-op, intra-op to the recovery area and then to home. So I think the facility is fantastic. And I think that the people that work here are some of the best nurses and techs that I've ever worked with. In my 20 plus years of being an anesthesiologist, as a group of surgeons, this is one of the best group of surgeons that I've ever worked with. And so I think working for OAW was just something that is more of a privilege for me. We like to look at ourselves more as a family here in the operating room. So it's a very nice, intimate place to work, and I think it's a really nice patient experience.